Hello, 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 and welcome back to the Bryan Laskin podcast. This podcast is exciting. I'm excited that you're here. It's about restoring something that has slowly slipped away from healthcare that we've been talking a lot about, but specifically today, we're going to be talking about the order of care. Because if you talk to almost anybody that's involved in healthcare today, you hear the exact same frustrations. Patients feel powerless. Doctors feel constrained. Practices feel squeezed, and everyone senses something about the system that isn't working the way that it should. My last book, Unfair Care, you can pick it up on Amazon. It's over 100 reviews, 4.9 rating. It's great. It's all about what's happened in healthcare and how dentistry fits in, how dentistry doesn't fit in, but also just how the system isn't designed to be, it's not broken. It's rigged, right? And everybody senses that. And patients struggle to understand their care. Clinicians are spending way more time navigating systems than treating actual patients. I mean, there's all sorts of symptoms that come from that, right? And organizations feel trapped between patient needs, insurance requirements, and operational complexity, right? It just feels way too complicated. And my friends, that is by design. And somewhere along the way, something subtle but very important has happened. Healthcare systems, including dental systems, have slowly stopped being designed around care, around making people feel cared for, about producing wellness and caring for patients. And they started being designed around administration. And there's in dentistry, this is spilling over massively, right? There's way more admins coming into dentistry than there are new dentists, than there are new clinicians. There's more and more people selling to dentists that have never treated a patient, right? And it's time for us to take back care. Now, don't misunderstand me. Administration does matter. Billing matters, compliance definitely matters, insurance matters. Those systems all exist for real reasons, right? But those systems have become the center of our industry, and that is something dangerous. So something dangerous happens when we shift away from care and we shift into all of these admin functionalities. Patients start to feel like they're navigating a bureaucracy instead of receiving care. You know why? Because they are. They hear complicated language. They see disconnected systems. Oh my gosh, that's, obviously a big problem that we've been focused on for a very long time. They get explanations that feel rushed or unclear, and slowly, like we talked about in the last episode, trust erodes, and patients don't trust us. When I got out of dental school 20 years ago, patients implicitly trusted everything you said. And now what do? They go to Dr. ChatGPT. Not because clinicians don't care, not because dentistry isn't effective, but because the experience of actually getting care has become confusing. It didn't used to be. But when patients feel confused, they delay decisions. And when they delay decisions, treatment gets postponed, obviously. And when treatment gets postponed, health suffers, right? When people put off their dental care, their health suffers. And healthcare didn't become broken overnight, right? It's drifted somewhat slowly, but kind of feels like it's going rapidly in dentistry right now. And what it's drifted toward was systems that manage care instead of systems that support care. And once that drift happens, restoring balance becomes a real challenge. And we have had a major drift where we are not really managing care as much. We're managing systems that support our care. And, think about the original promise of healthcare. The patient has a problem. They go and they seek the healthcare provider for help. And the clinician provides expertise and the patient receives the care. That's obviously it's basic, but that's the essence of healthcare. Somebody who needs help and an expert that delivers that help, or experts. But modern healthcare systems, and more, this includes dentistry, have added layer after layer of complexity. Insurance verification. Is that a problem for you? For a lot. Claims processing, documentation requirements, software platforms, data silos that keep you from the information of the patients that you see. referral coordination challenges that are massive, to the point where 35% of referred treatment never gets done today. And each layer has been added for a reason, but collectively, these layers create something that is completely unintended. They've created distance between the patient and their care, that original framework of what healthcare is all about. And patients now spend enormous energy navigating a system instead of focusing on their health. And that includes dentistry. And clinicians spend an enormous amount of time and energy navigating the system instead of focusing on patients, right? So imagine this from the patient's perspective. That's kind of what I ask you to do in the Patient First Manifesto, my first book, right? Looking at your practice through the lens of your patient, because, my friends, for good reasons that I outline in this book, it's next to impossible for clinicians to do. But try. Read the book and to learn how. But imagine your practice from the patient's perspective, their experience, right? You go to a dental appointment, you hear terminology that you don't fully understand, right? It's spoken to you because it's so native to us in dentistry that we just say it to patients and they don't understand it. You hear insurance explanations that frankly don't even make sense to me, let alone the patient. You hear cost estimates. If you're lucky, you actually get a good faith estimate. And often you leave with a question that never gets asked out loud because you're embarrassed, because everybody feels rushed. That question that gets unsaid is very simple. What should I actually do next? Not what could be done, not what insurance might cover, not what estimate might be, but what should I actually do next? Because when patients know that answer clearly, something powerful happens. They act. They actually schedule their appointment. They trust the process. But when the answer goes uncertain, care breaks down. I personally have been told by two separate physicians, two separate occasions, about procedures that they wanted me to do that they talked about, and then they just said, go talk to the person at the front desk. And I had no clue what the hell they were talking about. And they left the room before I could even ask. And in both instances, you know what I did? I walked right past the front desk and never even stopped. And I just went to go see another clinician in both cases. And my friends, that's happening in our dental practices, because you think the person at the front desk has time to ask the person walking out the front door. No, they're doing 12 things at once, right? So this is why I believe something important needs to happen in dentistry today. We need to take back care. That phrase means something very specific. It doesn't mean rejecting technology. It doesn't mean rejecting insurance. It doesn't mean rejecting operational systems. Those things are part of modern healthcare. In fact, we're bringing a lot of these tools to help you take back care through those means, through technology, right? But what it means is restoring the patient to the center of the system, and that includes technology. Patients should understand their care. Patients should feel confident in their decisions. Patients should feel connected to the people that are treating them, to you, to the clinicians, to the dentist, to the hygienist. When those things happen, healthcare works, right? So we need to bring healthcare back to what's called patient-centered, or patient-first, patient-centered healthcare system. And the idea leads to a simple operating truth that I've been reverberating on this podcast, that if you care more, you make more, right? So if you put patients at the center, they feel cared for and you make more. When healthcare systems consistently deliver three things: connection, clarity, and confidence, patients trust the process. And when patients trust that process, organizations see something remarkable. Treatment acceptance improves, recall improves, referrals increase, not because patients were convinced, but because they were confident. I'm going to say that again. Patients don't need to be convinced. Patients need to be confident. And that comes through authenticity, clarity, and providing patients with the connection and feeling cared for. That's what drives patient acceptance, not convincing them, not some sales tactic, but delivering care that patients are confident in by putting them at the center. So today, we're going to go through our CEO diagnostic for this episode. So if you lead a dental organization or healthcare company, ask yourself these questions based on today's episode. Do your systems make care clearer for patients or more complicated? Do patients leave appointments knowing exactly what to do next? That's a big one. You might want to ask more than one person in your organization if you don't know. If you're leading the organization, oftentimes you don't even if you're a dentist in a single location, you probably don't even know if patients leave appointments knowing exactly what to do next, unless you're the one making that clear. So, do your systems make care clearer for patients or more complicated? Do patients leave the appointments knowing exactly what to do next? Do clinicians spend more time navigating systems or caring for patients? Can clinicians spend the time they need to care for patients? And is your organization designed around patient clarity or administrative efficiency? That's a tough one to answer for a lot of leaders in a healthcare organization today. Are you optimized for patient clarity or operational efficiency? Because if care isn't clear, confidence disappears. And when confidence disappears, treatment disappears. So, in closing, like I always say, dentistry is filled with incredible clinicians. We have extremely talented people who are extremely well trained. Incredible team members. We have great technology. The challenge that we face today isn't capability, it's alignment. It's alignment. We need systems that reconnect patients with their care, systems that create understanding with our patients, systems that build trust. Because when patients truly understand their health, they act. And when healthcare systems care more, they naturally make more, right? More completed care, healthier patients, more trust in the system. And that's how we begin to do something bigger. That's how we begin to take back care, by focusing on creating a patient-centered system that makes people feel more cared for. Thank you again for listening to this episode of the Bryan Laskin podcast, and I look forward to seeing you here next week.